Right. Welcome to the decision session of the Executive Member for Housing and Safer Neighbourhoods. I'm Councillor Denise Craghill, the Executive Member. Agenda item number 1, I have no declarations of interest to make. Agenda item number 2 is the minutes, and I'm happy to approve the minutes of the meeting held on the 20th of October. I understand we have no public participants, so we can move on to agenda item number 4, which is the update on the resettlement pathway. So I have Tracy Carter here and Dennis Southall, who is going to start.
If I give a brief introduction to what the report's about, and then ask Den to talk a little bit more about the new approach that we are been piloting and want to promote. So the resettlement pathway, that's the terminology we use to describe the approach that we take to single people who become homeless or are rough sleeping, and it's how to get those people back into settled housing so that they can get their lives back on track. There are a number of contracts that relate to that pathway, some of which have been extended. This report specifically asks for the extension of one further contract to be able to complete the review that we've been undertaking. But the report also sets out some of the really good progress that's been made on trialling a more intensive and personal intervention, intensive support approach to deal with people and get them into better accommodations and deal with the realities and the personal details of their life rather than to take a generic approach. And that is through the use of a kind of navigator pathway, which Den can tell us about.
Thanks, Tracy. So yes, so this part of the pathway deals essentially with people who we would class as rough sleepers, who often lead chaotic lifestyles and have high personal needs, which can range across health, mental health, substance abuse, psychological issues, and trauma being some examples of that. We had a contract in place with the Salvation Army to provide early intensive and prevention work, which has been successful. But a lot has changed in the time that contract has been available to us over the 5 years it's been in place. And I think the changes that we've seen are a large increase in funding from government to deal with the national problem of rough sleeping, which was a real issue for the public in the middle of this decade. That the money that we have successfully bid for over time has allowed us to develop in line with, in conjunction with what is now DLUC, the Department responsible for local government, to develop ever more personalised and intensive approaches, and also more variety within our pathway. The traditional model is around hostel accommodation, so where people have a bed and shared facilities, and our approach has moved away from that, in that just getting people into services, getting a roof over their head, and then working with them over a period of time, often in an environment which doesn't work for everybody, which can actually re-traumatize some of the people going through that, depending on their personal circumstances. And it also meant that a lot of people were excluded because they just couldn't cope with that sort of environment. So, and they were often the most chaotic people in the city. What the development using the Rough Sleeping Initiative grant funding that we've successfully bid for over time has allowed us to do is to develop the Navigator service, which takes a step forward on engagement with rough sleepers on the streets or in accommodation. And in particular, it's allowed us to develop our housing first approach, York being one of the first authorities to have a sizable programme in place and successfully working. Again, that's been agreed and worked up with DLUC as well as local partners as well. Now that's been a successful programme and it's expanding, and that reflects the direction of travel that we want to take the service in. And that brings me on to the review. Now, the whole resettlement pathway, as Tracy has indicated, is made up of a number of contracts. Some of those are commissioned by Adult Social Care and have been over a number of years using money that was formerly known as Supporting People money. Those contracts were due to come to an end early 2002. 22, sorry, not 2002. That was quite a few. And between across services, we wanted to take the opportunity to review the existing pathway and to set some ambitious goals for the future and develop services so that they were more in line with the approach that had been developed. The contracts were extended for a year, and the review started up. I helped chair that, and I know that you attended some of the excellent sessions that we had. We're somewhere down that review now, and attached to the report are some of the findings of the review. And I think we're at the stage now where we need to move into implementing those. Unfortunately, because of the staffing situation in our adult social care commissioning teams, we had to pause the review. We're now in a position to be able to pick that up, and initial meetings are in people's diaries now to take that forward. I won't run through it, but some of the issues through the extensive research that happened as part of that review are reflected in some of the themes and actions that we've highlighted in the annex attached to the report. There's also an overview document of the current resettlement pathway and the numbers involved. Just to emphasise that the front end, the engaging with people who are sleeping, is extremely important, but it is only a small part of the overall pathway, which is about being as personalised and as personalised as we can possibly be in getting people into stable, settled accommodation using a variety of models. But it is absolutely key that we ensure that those services are personalised, and we support not only the people through that, but the teams that deliver those services as well. You'll see that one of the ambitions is to reward and remunerate staff appropriately as part of our ambitions around the pathway. So I would just bring you back to the recommendations, which are about noting the ongoing review of the resettlement pathway and the contract arrangements around that. The second one is about allowing us to implement the first phase of the review findings, seek that waiver to extend the early intervention and prevention service for 6 months. That is ready to go, should the decision be one in favour of that. That's been signed off by finance and procurement, who've worked with, who officers have worked with to get that ready to go. And obviously, what we want to do is conclude the review of the resettlement pathway and bring back to executive a report setting out the new delivery model and the transition arrangements through into delivery. Just in addition to that, I can currently confirm that the indications are our rough sleeping numbers are down at the moment. As you know, they fluctuate day to day, and over the time we had our official count in early November, which was 9, and numbers are below that at the moment, very low. We're meeting fortnightly with Salvation Army around the management, the extension of management, should it happen, of the contracts. making sure that is a smooth transition. The NatPad facility is up and running and continues to house some complex individuals. I've made contact with the national coordinator to discuss the future of the NatPad, which I hope to retain in York, but it is a Salvation Army facility, so ultimately the decision will there, but I'll do everything to see that we can retain that. Meetings are in diaries around the with adults commissioning around the resettlement review, and also around taking forward another ambition that we have around specialist accommodation and support for people with mental health issues in particular.
Right, thank you very much for that. I think it's a really important point that the services we provide to homeless people, there's many threads and streams and aspects to that, and it's quite complicated, really. I was just going to ask, following up, you covered a lot of. I was going to ask you a question which you've already covered quite a lot of about the resettlement pathway, but just to really clarify. The resettlement pathway that we're talking about here doesn't generally include families with children specifically. That's a slightly different path. It might overlap occasionally, but is that right? Could you just clarify that?
Yes, that's right. Historically in York, we again have been at the leading edge of services around homelessness and rough sleeping, having achieved gold standard for our homeless services a number of years ago. As I think is outlined in the report, there is the Homelessness Reduction Act, which sits on top of the Housing Act, which deals with homelessness. The Homeless Reduction Act gave extra duties. It firmed up our duties, in particular to those people who weren't particularly covered under previous legislation, and quite often across the country were neglected by homelessness services. In York, we were ahead of the game, and we had a robust pathway in the form of the resettlement services for single homeless people in particular, who often fell through the net elsewhere. Whilst the Homeless Reduction Act brought some challenges with that, burdens money in the form of rough sleeping initiative money and homeless prevention grants have allowed us to develop our existing pathways. And that is essentially, we have, as you will be aware, James House, which is a 57 unit, also contains all new builds. All new in a refurbished building, and that's the main accommodation for our families who find themselves homeless, and the teams there are able to work with that. Single homeless people, often known or having to rough sleep, are managed through our resettlement pathway, which, as you quite correctly reflect, is developing to provide a lot more variety, a lot more personalised services. And whilst they're not entirely separate, because we have homelessness duties to anybody who's vulnerable and homeless, because of the specialist nature of the services that, in particular, single homelessness requires, we've developed that approach over time in the ways that is set out in the report. Just to bring you back to the review findings, part of it is about rapid rehousing. So there are people who go into that, who become homeless, who may be threatened with or are actually rough sleeping, who don't need a lot of support. They just need a bit of help getting back into accommodation and getting set up properly. And that is very much part of the path where we have private rented sector officers who, over one winter period, helped 17 people almost immediately into the private rented sector, because they didn't need to go into a hostel. They probably wouldn't have been the best environment. They needed a helping hand to get back into the housing market in the private rented sector, and we successfully did that.
Yeah, thank you. Right, so I just got a few comments to add of my own. I was going to start by mentioning the broader resettlement review, which, as you say, I did take part in those workshops, and it was really very inspiring to work with such a wide range of people that included frontline workers from a lot of different organisations and departments, and people with lived experience of homelessness and leading researchers in the field. And I do think it's really important to emphasise that this work is building on approaches in York that have already had a lot of success in recent years. And that's demonstrated by the government funding that our homelessness services keep on attracting. And I think that point's highlighted in the summary at Annex A, that this is about building on and improving what already works, was one of the findings. But it's also, of course, it's about responding to the additional pressures that everyone's now experiencing with the cost of living crisis, pressure on households, mortgages, retaining tenancies, and the increased numbers of people you are getting seeking housing support. So I think it is crucial that we do everything we possibly can to maximise the effectiveness of the resources that we have. Picking up some of the points in Annex A from the resettlement workshops about even closer partnership working, consistency of support for individuals, and preventing people going around that revolving door that does sometimes still happen from the streets back onto the streets instead of into a new tenancy. I think that's really important work. And that intensive support that you've talked about, Dan, that comes from with housing first approaches and with other schemes such as our housing navigators, it really does make a difference and is clearly the right way to go and the right model for our early intervention and prevention service. I think there were some quite radical ideas discussed in the workshops, which you've touched on a bit, sort of ideas such as reviewing the longer term role of hostels in future provision. And clearly the challenge for some of those changes will be to identify sufficient funding to make the transition across the whole system. But I really look forward on that to seeing the recommendations of the project board, and the meetings you've referred to are already now in the diary. So in the meantime, I'm happy to approve the recommendations at paragraph 2 of the report on page 5. Thank you. I'm not aware of any urgent business.